I was thinking about talking about cancer therapy from a holistic standpoint. And I did a video on this not too long ago with a little dog named Raven who has a transitional cell carcinoma. And basically, we're out a year in remission. um,
Good job.
and yeah, and I just think like it's kind of common for this to happen. I remember once I was in a lecture room with Steve Marsden, who's one of our holistic vets that does a lot of speaking, and he just said, "Okay, let's talk about cancer. How many vets in this room?" And there was about 150 of us or something. How many vets in this room have seen a huge difference with treating cancer with herbs and holistic medicine? And just what you thought, like maybe a lymphoma that went out longer than it should have, or a tumor, malignant tumor that shouldn't have made it, or something like that. And like there was a good like half the people put their hands up, and we were all like beginner vets back, with the holistic, just learning the herbs. But he just said it's really easy to influence these cases in a positive way.
Yeah, that's
What
what
do
I
you
kind of, I always tell my clients that I can't promise them anything, but we sometimes get miracles. But at worst, they're going to feel as good as they can possibly feel. So we can either do no harm or a lot of good, or maybe strive for a miracle. But they almost always feel better when we're doing the holistic therapies.
Right, just like supporting their body. I mean, is that what you attribute it to? Is just kind of doing things to help pain, or is it more like I mean, is it more than that, do you think? Is there something deeper than that?
Well, I mean, don't you think that some of the cancers we see aren't necessarily painful, or they might even be discovered before the animals showing any discomfort? But I think what we do is we start with the foundation. So it's always a relief when I have a new client come and they're making food for their dog, or they're buying, their fresh prepared foods. And so we're already starting off at kind of like a higher nutritional plane. But a lot of times they come in and they're very proud that they're still feeding this very good quality kibble. And so we start by educating them that we can do so much more, that even the best quality kibble is still not ideal. And so I try not to zoom in on just the cancer, but starting out always with nutrition to kind of build a foundation, because otherwise our acupuncture and the herbs and the supplements don't really have a lot to work with if the whole system is kind of weak.
Yeah, that's a great way. I used to think that's a great way to put it. And I used to think of it as like kind of like almost like my herbs and acupuncture were on one side of a badminton table, and the diet and the vital force was on the other side. And like I felt like if I had some, I have a good partner on the other side that I could volley a little bit. But if it was just me, I couldn't feel like I did anything. I don't know, but it sounds like you've seen that too. I know I'm always relieved when their diet is where it needs to be to start with, because if it sometimes feels like with some of the bad cases, like, okay, we're going to talk about diet and supplements and herbs and stuff, and you feel like you're throwing a lot at them sometimes. But
But don't you find that a lot of your clients will come in and they're giving them so many different supplements, but yet their digestion's not perfect? And I
yeah,
think by having too much for their bodies to assimilate, if they're not absorbing and digesting really well, a
yeah,
lot of those really good things are just going right through them.
yeah,
So I'm always relieved when I have a patient that's got really good digestion, because I think that's kind of like the core. That's where all the cheese and
yeah.
butter are made. So if their digestion is good and they're eating well, we can kind of get them on that really super duper good diet. And then we can start adding the herbs in, and of course the acupuncture. But if they're not eating well to start with,
Yeah, that's
I
tough.
know it's going to be a harder journey, because
Mhm.
we have to work on their spleen in Chinese medicine,
Mhm.
and help build that up so that they can process everything that we're giving them.
Yeah, that's a great way to put it. Are there any favorite diets that you like to see them on right away?
Well, I personally don't cook. I can barely boil an egg. So I tell my clients at the very, very beginning that I am not the person to come to for actual recipes, and then I send them to you.
Yep.
But we now have we have a new generation of fresh food where the meat is cooked, but then it's got all the vegetables and everything else added. And there's quite a few brands that are, I think, really well prepared. And I like those when I'm treating my cancer patients because I feel like their systems are weaker. When I have younger, healthy dogs, they're often eating a homemade raw diet. But when I'm starting an elderly patient or one that's taking a lot of medicines, I don't usually start with the raw diets. We usually do freshly prepared diets, but where the meat is cooked. And then we take away that little teeny bit of a risk of something bad getting in there because their vital forces are not strong enough to really handle that risk.
That's perfect. And then with the herbs, I mean, do you have any favorite cases you want to talk about at all? I mean,
Yeah, I've been doing this for so long that my cases are all blended together. And they're kind of like these just kind of like overall like balloons of cases and ideas, but they kind of fall into different patterns. And I lots of times clients will come in and they've just got a cancer diagnosis and they're very distraught and they don't know what to do. And depending on the type of cancer, I'll often suggest that they have a conversation with an oncologist so that they can learn more about the kind of cancer that their dog or cat has, because the oncologists have a lot more information than I have to offer in terms of the conventional survival times and possible treatment protocols. And I almost always will tell somebody that I'm not against them doing surgery or chemo or radiation if they feel like that's the path they want to pursue. And I like them to have all of that information at their fingertips in the very beginning. Because what will sometimes happen is a member of the family is not 100% comfortable with a holistic approach. And if the patient is not doing well or eventually starts to decline, then the family's upset and out of balance and wants to go see an oncologist or a surgeon. And I kind of feel like then they've lost a lot of time. So with a lot of my patients, I'll often suggest, whether it's cancer or another serious disease, if they're going to pursue a consult with a specialist, to do it at the beginning so they have all the information. And I will work with them in whatever capacity they would like me to work with them.
Yeah, that's really open of you.
And sometimes it's hard because I don't necessarily think they're making the right decisions, but I'm there for them. And what I will often explain, if I have a patient coming in that the owner is feeling very inclined or is getting a lot of pressure to do chemo, then the herbs that I might start out with would be herbs to really help support the immune system and also mitigate any side effects of chemo or radiation, or if they've had surgery, to help recover from surgery. But if they're not doing any of the conventional treatments, then we have like the whole array of holistic treatments to do. And I have 2 different sets of herbs that I use and 2 different treatment strategies that I use with the acupuncture. And one is what I've already mentioned, is to throw everything at supporting the immune system, which includes the diet and the acupuncture and the herbs. But if we're actually treating the cancer, then I will go to different categories of herbs to help treat the cancer. And I never promise that I can cure the cancer. I don't want to dangle a carrot in front of anybody, but we pull in the herbs. They're typically chi and blood invigorating herbs and phlegm clearers. And we try to keep these masses from growing. That's my first goal. And then if we're making some progress, to hopefully shrink the mass and maybe make it go away.
Yeah. And I wanted to just remember, I thought we could even talk about Tessa, because we shared a case where she did this, it was a non-surgical, non-treatable that I remember, brain tumor. And
Golden retriever, right?
I'm trying to remember the gal's name. She looked like a golden retriever, you know, that's all I remember, blonde hair. But anyway,
I remember her name, but I don't know who
say it.
she's.
Yeah, that's okay. Anyway, nice gal. And she got an MRI before you started doing the herbs, got her diagnosis of a brain tumor. And she also did the MRI after the herbs. So it was a really cool thing with that brain tumor to actually see the immense reduction that you were able to help with that dog. And do you want to kind of fill people in a little bit on that, if you remember, or even a case that's
Yes,
like it?
and I mean, we did regular acupuncture.
Mhm.
We changed the diet. In those days, we didn't have these newer, freshly prepared foods with the meat cooked, but she had been on a very healthy diet her whole life. So we kept going with her raw food diet. She was eating Darwin's,
Mm.
and we did a lot of herbs and supplements to support her immune system. And she still worked with a regular vet. And we have some really great regular vets here in Seattle
Yeah.
that are very happy to work as a team and do the follow-up blood work or x-rays, or in this case, an MRI. And what we'll see often, besides the cancer hopefully getting better, that the patient is starting to thrive because they're eating really good food
Yeah.
and they're taking herbs also to support their immune system and to support their digestion, and their coats start to look better. And they're feeling often, even with this terrible diagnosis, better than they felt before.
I know, I see that all the time, but it was such a cool case. But it's like what I see is that they just thrive, 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 thrive. And it could be a month. It could be, if it's a bad cancer, it could be 3 months. It could be 6 months. It could be couple of years. I had one lymphoma go out 4 years. And then what happens is they're great, great, great. And then they crash. And then at that point, I just tell them the cancer, basically has come back, because it was in remission. And that's what I call it remission. I don't know if you call it remission, but when they shrink or the tumors, get smaller, or the blood numbers get better in the case of lymphoma and stuff like that. I'm calling that remission. I'm not sure. What do you think about the term remission?
It's hard to know. I think it's hard to know even in Western medicine.
Yeah. I mean, they may claim it more often than it actually happens. It's hard to say, but
But I often, if cancer in general, besides some of the giant breed dogs, it's going to affect our older patients.
mhm.
And if we can just slow down the growth of the
Yeah.
cancer, that's one of the things I'll often talk to my clients about, that we've got elderly dogs. And if we can just slow the growth of the cancer down to kind of stay just a little behind the dog aging or the cat aging, sometimes they'll just age out with, geriatric
Yeah, they'll get
problems.
like
Vital
kidney
force.
or heart or something they would normally get.
Yeah.
Yeah, isn't that something to see that? I've got that happening right now in Seattle with this little kitty with intestinal lymphoma. Has been going on 3 years, and now she finally is 18 and has kidney failure. It's like
Right.
it's like, oh my goodness, I never thought we would see the day where we just do the normal kidney failure, fluids and things like that.
Right.
So
And how often have we as holistic vets worked on cancer patients and the tumors go away, the cancer goes away, and then a lot of the conventional practitioners will question their original diagnosis.
I've seen that so many times. I think you and I talked about it. And
Yep.
then sometimes it'll even like that, with that dog named Jackson. That's it's a gray golden, gray Labrador retriever that had the left front osteosarcoma, and it went into remission for 1.5 years. And even that I was kind of going, because he was on pain meds and they were going to amputate. And then, the herbs just held it. It held it. It was great. And for that long, that it made me almost question it. I'm like, maybe this isn't what this was. But then in the end, it was. You could see the different, if you saw the x-rays side by side, you saw the tumor, the osteosarcoma grow. But we're seeing a lot more cancer these days, but I think it's good to raise the awareness that there are holistic treatments for it. A lot of people don't want to, I guess a lot of vets don't want to say that there's treating cancer. They more say that they're supporting the immune system with the cancer. But I mean, I kind of go out on a limb and just say, no, we're treating cancer. It's just that, sometimes you get into liabilities, kind of like you were talking about with different family members not being on board and stuff. I just tell people if it's a cancer that I've never treated, I got this new gal who has Bernese mountain dogs they all seem to be dying at like under 5 years old of this histio histiocytosis type.
Mhm.
It's almost like a mast cell tumor, but as soon as they biopsy it or even do a fine needle aspirate, then the minute they do that, it aggravates it and it spreads, and grows really fast. And so, have you ever dealt with that kind of? I told her we're going to put the dog on mushrooms, and she so far she's just doing it preventatively with the
Yeah, I
Bernese
think
mountain
that's
dog she has left.
cancer to treat.
Okay, have you tried to treat it, or have you worked with it?
I've only had a couple over the years, and I think we've been able to slow it down, but I cannot think of any I haven't gotten a miracle with one of those.
Okay, yeah, that seems tougher. A lot of
But
genetic treat
a
cancers.
lot,
Yeah, go
yeah,
ahead.
but I mean, when we've got genetics coming into play, which we're going to have more of, I think, in the coming years, in Chinese medicine, what do we know about genetics? That's the kidney essence, the
Yes,
kidney qi. And so there's a lesson there for the breeders, and if
yes,
um, to start kind of working on this kidney energy, which is really truly the foundation.
yeah,
And one of the things that's so nice that we can do with especially going back to the diet, besides the herbs, is anything extra that we can put in to nurture their bodies and support their kidney qi and their kidney jing and their spleen qi
mhm,
helps preserve what's left with what they were born with. And a
yeah,
lot of these animals with the kidney qi or kidney essence deficiencies were born with congenital weaknesses, and then we kind of see it play out. And so by nourishing their postnatal qi or essence with the food and the herbs, we help them conserve the little bit that they have left.
yes,
And
yes,
one of
yeah.
the things
That's
I love about what we do
mhm,
is it's often a learning experience. I mean, we've been doing it for decades,
mhm,
but sometimes we have clients will come in and it's brand new for them. And
mhm.
they learn about all these things that we can do. And so they've got a geriatric patient with cancer, but then they'll often have another dog or a cat, or they're going to get more in the future. And then we get to work right away. And I love when we can start with like a young adult or a
Yeah,
puppy.
with the preventative, you can go, okay, we're going to work on because usually a lot of times if they share genetics, it's like, okay, well, let's work on the one that, also that, as a preventative for the one who doesn't have the cancer, at least yet.
Right? Or even if they're just housemates
Mhm,
in the same environment. And that's one of the things that I think is really interesting about holistic medicine is
mhm.
people think of the acupuncture, it's become kind of mainstream, and that's
Yeah.
fabulous. And people can go to, human doctors can take courses and vets can take courses in medical acupuncture.
Mhm,
And it's very, very effective,
mhm.
and it can help with pain and inflammation and muscle spasms and the immune system. But what a lot of people don't realize with Chinese medicine, it's a whole system, which includes diagnosis and prevention. It's not just treating pain and inflammation. And
Mhm.
so if we can start with our patients and people who've had a cancer patient and then get another dog or a cat or have the others, they're starting to think like, what can I do for my healthy animal?
Yeah.
And then we'll kind of zoom in and do a consult, maybe not like treatments all the time, but we go looking for where their imbalances are.
Yeah. That's the perfect way to
Like
interact.
that's never been a good eater. And I was
Mhm.
like, okay, well, let's like work on that because that's going to turn into a problem possibly in their spleen or liver when they're older. And
Yeah.
so,
Well, that's
oh,
actually, can I stop you there? So
sure.
that is kind of what I think is one of the main causes of splenic hemangiosarcomas is a kind of long-term digestive weakness. And but then it transfers, into this tumor. I think I see that a lot. Do you think you see that a lot?
I think I see that a lot, but I even more than that are the dogs with the weak GI systems, not great appetites or intermittent diarrhea. that end up, we have an epidemic of inflammatory bowel disease and then lymphoma. And so
Yes.
it's kind of the same system. And
Yeah.
I think if constitutionally they have more of a stagnant constitution, we might end up with like real masses like hemangiosarcomas.
Mhm.
But if they have a different kind of constitution, maybe with more dampness or phlegm, they may end up with more inflammatory bowel disease or lymphoma, but it's the same root.
Yeah, that's a great point. Boy, this conversation could be like hours. Well, I wanted to just quick because I just kind of dove right in here because I wanted to tell people about you real quick. So you're one of my best friends, Dr. Naomi Bierman, um, graduated from Cornell in 19.
1988.
You okay? 88. Okay, okay. No, that's
A
good.
really long time ago.
Yep, that's good. So graduated from Cornell in 88, then went and did an kind of a internship or something up in with cows in Wisconsin, right? I mean, all I have is cows and goats and in my
I was
head.
actually a dairy vet in Wisconsin, straight out of vet school. Um, I actually always saw myself working with small ruminant sheep and goats. And the only way I could get sheep and goat experience in this country was to like throw myself in. And so I went to Madison, Wisconsin, and I worked in a dairy practice about 30 miles out. So I got to live in like a really cool city, and yet I could still be in the country a little while later. And then I took the IVAS course, the International Vet Acupuncture Society course in 1992. And I thought, oh my goodness, why didn't we learn all about this in
In
vet school?
school. We should have learned it in school. I
Should have.
know.
But now a lot of the vet schools offer an acupuncture course, but back then we
Yeah,
didn't
it's
really have
getting a
that.
little better. Yeah. Yep. Yeah. Back then it was like, okay, every man for himself.
And so I learned that. And then I also took Richard Pitcairn's homeopathy course. So I was like all over everything holistic.
Cool.
And I worked at a busy referral practice in Madison. And I got to do the holistic work, but we had an internal medicine person, we had a surgeon, we had a geriatric specialist, we had a dentist. And I just got to work up my own cases. And then if I had questions, there was a
I was like,
specialist right there.
perfect.
But
Yeah.
then I realized I still don't know quite as much about acupuncture as I think I should know. And then I moved to Seattle and went to human acupuncture school.
But
And
were
that was
you?
where it really started.
Yeah, that was amazing. You're a graduate of NIOM.
Yes. Hmm.
So what were you going for ruminant medicine because you were thinking you were going to go work in another country, or what was that
Yes.
thing?
I always thought I was going to work doing small ruminant co ops somewhere in Latin America.
Okay.
And I was interested in that from kind of a political, ecological perspective.
Yeah.
But then the holistic medicine came my way. And
Yeah.
so that wasn't good. It was no longer my main priority. But then, should we talk about how we ended up in Latin America together anyway? In
Sure.
Cuba?
I was getting there, but I was just working up
Okay, well,
to
you
it.
go because this is your story.
No, no, I like hearing it from your point of view, but yeah, well, you and I met in, I think it was 97 at in New Orleans at the AHVMA conference,
It
right?
was flooding. The hotel was flooding, and yeah,
Oh,
we
I
were
kind of
there.
forgot about the flooding.
Yep.
Okay, that one I forgot. I just remember meeting you. This is so
Yeah, we were
and
both in Seattle for a couple of years, but we met there.
yeah, that was funny. Yes, that's true. We
Mhm.
started our practices in
Yeah, we
94
were
in
probably
Seattle.
wary and skeptical if we would like each other or not, but
Oh,
here we are
I liked you
decades
right
later, best
away.
friends. Yeah.
I was like, she's a soul sister. Um, well, and then yes, and then you being you, which is always has a million things going on and just the most amazing sort of organizer. You organized a course in veterinary acupuncture in Cuba, and I was lucky enough to tag along and help out. Just it was such an amazing experience, and I think it'll always stick with me as one of the coolest things I've done. And it's all because of you and Eric Hartman and others who put this just ginormous course together. Yeah, I mean, I just remember I didn't know that much Spanish. So we were trying to figure out how to show these acupuncture points to the students on these horses, which were kind of like horse and buggy in front of this
This is one of my
hotel.
favorite stories. Go on.
Yeah. And so I looked at the person, the man that was driving the buggy. I don't know what you call him in Spanish. But anyway, and I said, is there possible? I just said sin ropa. It was like which meant no clothes. Could you put this horse naked? And he thought that was just so funny. I think he
I
was
still think
talking
it's
for like
funny, but
20
years
minutes.
later.
I'm like, what? I just wanted his saddle and stuff off, and all his driving equipment. And so we actually did it right in front of the hotel. It was really great.
And then
But
you went over to somebody's derm clinic. You visited a couple of clinics.
Jose, gosh,
Mhm.
what was Jose's last name? Dr. Oh, yes, I did. It was great. Oh my gosh, what an experience to go, just to go kind of see how veterinarians work in other countries. And then we even visited some clinics. Remember that? Some herbal
Mhm.
clinics. And I remember looking over and going, wow, they're cutting up turmeric for human patients. It was just, I'm like, oh, turmeric, right. They have it probably here, and like they didn't have to go to the co-op and the PCC and get it in when it's in season. I'm like, oh yeah, just using medicines that are right there, has been really important for their culture, right? They're staying healthy through local plant medicine.
Yeah, they call it green medicine.
Medicina Verde.
Yep, that's right.
Hmm.
And it's an interesting perspective because it's a poor country, so they don't
Hmm.
have a lot of medicine and supplies and diagnostic equipment. And
Hmm.
so the vets that we were working with are very, very used to using their hands and
Yeah.
whatever resources are available.
Yes, we
And
could use a
so,
little of that here so we don't get so dependent on so much technology. you
right?
know?
And but those animals, a nice thing that we saw, even though there was a lot of poverty, is that the animals are not over vaccinated because they
Yeah.
don't have a lot of vaccines. They do very well with rabies control,
And
but
the foods were natural at least, right?
nobody could afford to buy a big bag of kibble, and yet they were envious about our kibble. And I remember there was one little store that we saw on the street, and they had a couple of like bags of dog food, and we're like, no, 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 don't waste your precious
I
money on the
know. We're
kibble.
like,
That's
no, no, eat the mice, eat the rats.
but those dogs are super well taken care of by their families, even
I
their
know so
resources are
well.
limited, and they get to eat real food, and they
Yeah,
don't
they're
get
eating their
bombarded with
meals
vaccines
with their,
every year.
yeah. I know it's kind of automatically more holistic, the whole culture. And I remember learning that there was a lot more organic produce in Cuba as well. Just by nature, they weren't using the chemicals because they didn't have access to them.
Well, that's exactly right. So once again, something really good happens by default, a lot of creativity, and they were working with soy co-ops and sustainable agriculture, organic produce. So there are a lot of silver linings.
Yeah, exactly. Interesting. I wonder, just as a digression, what the rates of cancer are or autism, just like if anyone ever would look at kind of how things are done there, if I mean, just health
Yeah, that would be
outcomes. Be
interesting. Yeah.
interesting. Let's see, is there anything else you want to say? I mean, one thing I wanted to ask you is if you had any advice for any young vets that are just starting out and thinking about what to learn, if there's something they should learn first, or how they can open themselves to this world. I mean, we clearly have not enough holistic vets. I cannot believe how few we have. And most of us doing it are a little bit older. So yeah,
Yeah.
any advice you have for the youngins?
Well, I love school. If I were to do it again, I would have gone to naturopathic school.
Mm,
In addition to human acupuncture school and the human herb program, because there's so much out there and that we never stop learning. And
hmm.
I mean, you're always taking courses, and we also keep up with the regular medicine too.
Hmm.
Um,
Yeah, it's a lot.
but my 5 years of doing human acupuncture and herbs is where I really, really learned this on such a deeper level. And
Hmm.
because there's no course that you can go to for a weekend and have like a real profound knowledge.
Yeah.
But there's so many things to explore. And you do chiropractic and you do NATE,
Mhm.
lots and lots of modalities.
Yeah, I mean, I was just thinking of like, if there's some way to have them just like start with something, I don't know. I was gonna say easy, but every single thing I learn, there's always like, wow, nuances and, which of the 200 chiropractic techniques do you want to learn? That kind of thing. I thought, gosh, maybe just acupuncture is a good place to start, or even maybe homeopathy. What do you think?
Well, I think homeopathy is really, really, really complicated
Okay.
because we miss so many of the verbal cues. I mean, people can describe, waking up and seeing like a red dot, at 3 o'clock in the morning. We would never get that information from an
Yeah.
animal.
Wow.
So I like homeopathy for acute situations, but it's very, very difficult to do constitutional homeopathy, I find with patients.
Mhm.
And because I'm a worrier, I, well, I mean, I always worry, and I, it's hard to tell, if it's a person and they're having a healing crisis, and their signs and symptoms are worse, but they're feeling better, then they can kind of keep going. But with my patients, I get kind of like like I chicken out if they're getting worse, and I think maybe it's helping, but I'm not quite sure. So I didn't have like the courage to stick with a lot of my homeopathic prescribing when I was trying to work on deep cases. But for acute cases, I think it's fabulous.
Mhm.
Um, but the acupuncture, I think the acupuncture is a very, very good place to start
Mhm.
because a lot of the courses, there's the IVAS course and there's the Chi University course with Dr. Shea,
Yeah.
and then there's, human courses. But taking the vet courses when you're first coming out of vet school, they start off with all the neurophysiology,
Mhm.
and I think that's really important because we come out of there with like a science background, and some of us can make the leap more easily than others. But
Mhm.
for me, it actually helped to see all the science behind the acupuncture.
Yeah.
And then after I got comfortable with that and I started connecting dots, and I just dove deep into the whole Chinese medicine. But I would encourage, I think, almost everybody to start with acupuncture.
That's a great suggestion.
You can get really, really good results without having the profound knowledge. And then that knowledge comes later. And then you can tackle more things, harder problems, we talked about cancer right now, but we also have all the autoimmune diseases. And I think they go hand in hand. And the treatments are really similar.
Mhm.
And so you're not going to start off as a new graduate working on hard autoimmune cases, but the acupuncture, you'll see the results soon after starting, and you can
Mhm.
do no harm.
Yeah, that's great. I remember when I first got out of, kind of first got out here and started doing acupuncture at Chris Susumi's clinic
Mhm.
down in Renton, because she would just like line up these cases for me,
Chris
and
came to Cuba with us too.
yes, Chris was there. Yes, she's
Mhm.
probably watching this now.
Hi,
um,
Chris.
but yeah, she lined this case up, and it was just it was an immune mediated. It was like a 9-month-old dog or a year old dog with the joints all inflamed from the vaccine induced polyarthritis. And I was like sitting there scratching my head, going, I don't even have any herbs. I don't know what I would use. So then I viewed some very basic like cookbook points, and that dog like really within hours the acupuncture had reduced the swelling in the joints, and really just a couple of treatments cured him completely. And
That's
so,
amazing.
I just think of like all the steroids that are used and all this immunosuppressive therapies, and and it was just a few acupuncture with someone who's not even, at that point, especially not experienced even, just because I think a lot of vets think that they have to be experts before they do something. I don't know where we got that
Well,
because,
because you should be before you dive deep into like abdominal surgery.
oh, true enough.
So
But when it comes to acupuncture, how safe it is, I mean, get in there and just start doing it. If
safe.
you don't start doing it, you won't get, you're just gonna like people let the fear kind of, I mean,
Mhm.
and I do that sometimes too, whereas I don't want to take something on because it just seems so scary. But you just get in there and try it and just try it.
Yeah, because with Western medicine, if you make a mistake, you can do a lot of damage.
It's
And
true.
we have all the drugs that are like hitting hard against all the symptoms, the anti-inflammatories and antibiotics. And with the acupuncture, it just balances everything out so you can really do no harm. If the
Mhm.
white blood cells are too high, you're not going to make them higher because it's going to bring them down. If
Yeah.
tummy, like hydrochloric acid, is too high, the acupuncture will balance it out, but it's not going to make it higher.
Yeah. That's a good
Prescribe
point.
a medication um, based on a wrong diagnosis, you actually can do damage. And we do no harm, which is
Yeah. It's it's one of the reasons why I've stuck with it this long, because I just feel like, gosh, I mean, yeah, if I did conventional medicine and I don't know, and something went wrong, I'd feel so bad. With me, now I'm kind of like, oh yeah, I probably should have used a little stronger herb. Okay, let me just let her know. So, anything else you want to say?
gosh, there's so many things to say. We might have to save it for another time.
Okay, we'll do round two.
Okay.
Thanks so much, Dr. Bierman.